Hi, everybody. Welcome to GW Center for Integrative Medicine. I'm Dr. Kogan, Chief Medical Officer and Associate Professor of Medicine at George Washington University. So today's topic, effects of radiation on health. Now, we're only going to talk about ionized radiation from the tests, from imaging specifically, and we're going to make some comparisons, and we're also going to review a detailed recent study. So if this is the topic of your interest, to see how many cancers are caused by our own practice of medicine via images, and that's a lot. And what is your chance of dying from getting one CAT scan? Please tune into this video and let's dive right in. So without further ado, what I'm going to open with, I'm going to show you a standard table of how much each imaging test gives us in terms of radiation impact. So this is an AI generated table, so nothing really special. So if you look at the actual exposure, when we go through airport security scanner, you get very low dose. So this is, some people concerned about that. In reality, it's probably not a big exposure, but nonetheless, if you're flying a lot, it does add. Now, notice this interesting comparison, this equivalent to natural background radiation. What is natural background radiation? Well, the sun produces some radiation. There is some radiation coming from space to us. So this would be considered normal. So the airport security is negligible. The DEXA scan, I think, is also negligible. The one DEXA scan equals to less than 1 day. Now, this is the millisieverts or SVs. And you will see that they're actually quite important, because once we start talking about the mortality, what kills us in terms of radiation, I'll tell you some numbers in a second. But first, I want to cover this particular table. So moving on to dental x-rays, you see that it's about 5 times the level of DEXA scan. You're moving on to chest x-ray. Now, suddenly there's a pretty big jump. As you can see, there's a almost 200-fold jump from dental x-rays to chest x-rays. So this is a 10-fold jump, sorry, not 100-fold, 10-fold jump. So it's a pretty big jump. It's a 20-fold, actually, if you look at SVs. Mammogram 4 times that. And now we come to the 2 types of CAT scans. So I decided to include calcium score, which is considered to be low-level radiation and a pretty common tests. And they're only 1.7 MSVs, and you compare now that to the whole body CT, and that's 30. Now, if it's only a partial, let's say it's going to be a chest CT, it will be probably about 10 SVs, so it's still milli-SVs, it's still going to be about 5 to 6 times the dose of the calcium score. Now, look at the total amount of background radiation. So one CAT scan eats up to 10 years of our normal living without any imaging. So before I show you the most recent study linking CAT scans to cancer, I want to stop sharing. I want to tell you. So how does this compare to this kind of the really severe radiation? So something like Chernobyl, or like an instantly deadly dose of radiation that will kill people within a few hours or few days. So we're talking about not milli SVs, we're talking about SVs. So something like 1 SV could cause some mild symptoms immediately. At a dose of about 5 to 10 SV, that's where the mortality, quick mortality happens. Now, if you're getting only a couple of SVs, somewhere between 2 to 5, it'll probably shorten your life a lot. Due to cancers and due to other conditions like thyroid disruptions, other hormonal disruption. And but the data at lower doses obviously is going to be much harder to interpret. The actual mortality that is an immediate mortality within hours, days, and weeks would be somewhere around a dose of 5 to 7 SV. So now that is definitely it. We're talking about 30 milli SVs for the whole body CT, and here we're talking 30 times, 33 times to just get to 1 SV. So you're going to need 33 CAT scans to start having a serious immediate side effects of that dose. So that seems like, okay, trivial, right? What is 30 CAT scans? Well, believe it or not, there are a lot of people who get a dozen or more CAT scans because they either had a cancer and now they're followed with the CAT scans, or, they have some frequent traumas, they go to ER all the time, and there's really this kind of, oh, you had a head fall, okay, let's get your head scanned, because why not? Because you may have bleeding in your head. So hold your thought in terms of that comparison, in terms of number of CAT scans needed to literally die from them. So of course, almost no one will get enough CAT scans to directly cause the death from it, because you'll need to have a lot of CAT scans all at once. That's never going to happen. But now let's look at the actual recent data from the study that was just published very recently. And I'm going to share my screen again, so to show you the data. So this is the study that was published in JAMA. So, this is a very high quality article. And the title is Projected Lifetime Cancer Risk from Current Computed Tomography Imaging from CAT Scans, in short. So if you just read this title over here that I'm highlighting right here, this one, approximately 93 million, I just want to repeat this again, 93 million CAT scans were performed in just 1 year, in 2023, on 62 million people. And if you just run and you're going to listen to nothing else in this video, it will cause approximately 100,000 excessive cancers, okay? So what does that mean? Well, it means that the practice as usual that we engage running this CAT scans increases the risk of cancers quite substantially. Now, of course, you're going to say, well, wait a second, this is 62 million people and there's only 100,000 cancers. Well, you could think of that, but you could also think, well, how many total cancers are we getting out there per year? And believe it or not, suddenly that is a pretty substantial percentage. It's an approximation, so it's hard to say. But it's not all that off. About 10 to 20% of all cancers ever in the United States are going to be potentially in one way or another linked to the exposure to CAT scans and other images. Now, obviously, they're only looking at CAT scans because what I just showed you. If you compare CAT scan to, say, let's just compare it to the plain chest X-ray. The chest X-ray is about a 300 times lower dose, right? So you're talking at the very, very big difference. That's why this researchers didn't even bother going out there and comparing, because, this is a much clearer data. Although arguably one should say such a study needs to be done as well. So let's look into details. So the details of this, and by the way, how do they do this? This is computer modeling. So this is not necessarily easy to figure out, but they are using a special software to establish to figure this out. How? Well, remember what I just showed you in terms of the data. We know exactly how much radiation each cancer can produce, and we also know exactly how much radiation is needed for each organ or each system to trigger a significant increase in risk cancer. And then they're using computer modeling to figure out the numbers. So this is how this is created. So what I want to show you here is this tables. There's a couple of different tables. So this one, now this is really showing the total number of projected future cancers based on age. And you can notice that, and this we're talking about from one CAT scan, by the way. We're not talking about multiple CAT scans, because obviously if one person gets more than one CAT scan, they're going to have a higher risk. And so you're looking at this line, whether you're seeing that gradually over time the risk goes up, and you should arguably say, well, what happens here when there's a sudden drop? Well, because if you get a CAT scan at age of 80, I mean, you're probably just going to die from other causes, because your life expectancy at age of 80 is going to be pretty short relatively to if you're at age of, say, I don't know, whatever, 30. And because of that, even if you do get a CAT scan at 79, it's not going to really contribute much. That's why there's a drop. But if we were to live to 120, this would have continued growing up and up and up. So this would be a higher risk, because obviously, as older we get, our tissues are more frail. They're going to have more damage from radiation, not less. We have less capacity to repair it. So what's really, I thought, was done really well, they didn't only said, how do we look at all composite, or are some types of CAT scans are worse? And the answer is yes. So they looked at all cancers over here, and then they looked at the millions, in thousands, millions of CAT scans, so 93 million. And you can take a look at, so for example, the lung CT is going to cause the most, relatively speaking, of all the cancers. And then you go down gradually and the numbers are decreasing. So if you, for example, worried about your head being scanned, the head CT, so, it sits a lot lower. Partially, it has to do with a couple of things. So one, when we get a head CT, the area that gets radiation is much, much smaller, right? You're not going down there. So you're only up here and you stop. The lung area, it's pretty large because they have to go a little bit higher, a little bit lower to capture the whole area. So just the amount of sheer radiation in there is higher. And that is why. So each area, basically, you're looking at each CAT scan going to be different. Now, this is also projected cancer types. And you can see that the lung cancer risk is the highest from CT, again, for that same reason I just mentioned, etc. Now, you can also look, and this is, I think, one of this is in the, right, so this is a projected cancer, and this is the projected damage from each CT. And as I said, the abdomen, so actually abdomen and pelvis is just as bad as chest, or they're kind of close to each other here, because again, area of exposure, the bigger the exposure, the worse things are. Now full body, you would argue, they say, wait a second, what's going on here with full body? Because often full body is run at the lower amount of radiation because it's actually known. And often when we look at full body, the types of things we're trying to find out on a full body are often don't require high resolution. So the amount of radiation from each CAT scan depends on the area radiated and whether it's a high resolution or lower resolution. So you can see that the cardiac drops dramatically out because it's much low, even though you radiate large size, I mean, most of the chest, but it's low resolution. So if you compare cardiac to chest, there's almost 10-fold difference there because of that. Now, this is very interesting. It's actually sex and age exposure. So it doesn't matter what age, even at the low, kids or really old, you will increase the risk. But in old and very young, the risk is small. The risk peaks is basically in adulthood, somewhere between, as you see, 18 to 80, and it's kind of equally distributed by age. This is based on a projected number of CTs induced cancer by body region in adults and children. You can look at the children, but I'm gonna stay here with adults, and you can see that the abdomen and pelvis is by far the highest, and then chest, spine, full body, head. So this is, again, it's the same table we looked up, but in a graphics form. And so with that, I'm going to talk for a couple more minutes just to give you overall perspective as well as directions of thought process in terms of, okay, well, I have a particular illness and my doctor told me I need to get a CAT scan. Do I really need that CAT scan, or should I really be worried about this? So if you are in a life and death scenario, let's say you got hit by a car, you're in a hospital, they're fighting for your life. No one's ever going to consider talking to you about this is a risk of radiation. No, because you're trying to survive. So I am not discussing here life and death scenarios. I'm not talking about acute issues that are very problematic, where a decision needs to be made very quickly and the CAT scan would be the only test to immediately give you answers. I'm tabling that because in reality, those are the situations for which I think CT should always be used without even blinking or thinking and then dealing with consequences later. No, that's not what I'm talking about. What I'm talking about is what often described as a follow-up scans. What do I mean by that? It's extremely common when you go and do some kind of imaging and you are, let's say you're going to do, let's talk about, since I'm going to bring this up too. Let's say that you are going to get a whole body MRI because you listened to Brian Johnson or Peter Attia or one of those experts in anti-aging and longevity, and you said, okay, I want to be proactive. I want to get a full body MRI, and I want to make sure that nothing is growing in there. Well, here comes the trouble. in most of the times when you do something like this, there's a chance that the MRI is going to reveal something. MRI is going to show a shadow, MRI may show a nodule, MRI may show a mass, which may or may not have anything to do with anything. Sometimes there's what we call granulomas and recovery from old infections. Sometimes these things are benign fibrotic tissue, which is bulked together and it now looks like a mass. So there could be all kinds of benign lesions. But once it's there and you see it, quite often the system will automatically say, okay, it's the area where you actually now need to get a CAT scan for a better visualization. Or they may say, okay, well, you don't necessarily need a CAT scan now because we see this lesion. Let's do the CAT scan in 6 months. And then we'll do another CAT scan in 6 months after because we want to make sure lesion is not growing. So this is a typical follow-up we will do. System does not have a much finer tools. Repeating MRIs is not always possible. Repeating MRIs is not always going to be insurance covered, but CT will be. And so you're going to sit there and you're going to think, well, do I pay or do I get a radiation exposure? So hopefully this conversation helps you to decide. The way I think about this goes like this: absolutely no to any exploratory imaging when you have no symptoms. When you have no problems of any kind, unless you're suspicious of something and you can't quite verbalize it. Let's say I had multiple scenarios in my practice where a patient would come and say, you know, something is off. Like I can't tell you exactly what it is. I've had some abdominal symptom changes. It's not quite a pain, but I feel some bloating, this and that. I take that seriously because there is a symptom. Patient may not pinpoint it, but this is real. But if somebody comes to me and says, oh, you know, I just read the recent study and they say that maybe I should start doing annual CAT scans to see if I can find ovarian cancer early. Well, you just saw the data. There is a chance that doing these CAT scans is going to cause you ovarian cancer and you shouldn't be doing it. And that is a warning. This is warning to everybody. Please be careful. Pay attention to minimize exposure to any kind of x-rays for any reason unless there's absolutely, you know, no other way. I would say that dental x-rays are exception. It's a pretty low dose. DEXA scans are exception. But even mammogram to me is already concerning enough. I just told you that mammogram is 0.4 MSV, which means that it's actually 4 times worse than a chest x-ray. And yes, it's still 10 times better than, actually more like 50 times, 60 times better, or 70 times better than the CAT scan. But it's still, you know, it's still quite a bit more than DEXA or dental, where you're talking about, for dental, it's a 0.005 versus 0.4 for the mammogram. So I hope that the new testing for mammograms will be a non-radiation based. I know there is already technology here. Hopefully it'll grow very quickly. We can at some point talk about this. But meantime, I hope this video was helpful for you all. Stay safe. Avoid unnecessary imaging. Don't just discuss with your doctor. Do your own research, because sometimes doctors will push you for the tests because they are afraid they're going to miss something. And if you're going to say, I understand your concern, you're afraid that there may be a lesion of some sort that we're going to miss, but I will take responsibility for it and I'm not going to do the test, or I'm going to do tests less frequent. That's another option, right? If there is a lesion that was of a concern and now they said, let's follow it every 3 months, you could say, well, I don't want to follow it every 3 months. I'm going to follow it every 12 months. And if it's stable, I'm only going to check it once or twice. I find it quite interesting how practice in Europe is very different from US. In Europe, this follow-up tests are done a lot less frequent, sometimes not done at all, or they will do them in a very non-specific way. They will just do them when the physician in a year or two will follow up with the patient and say, let's check now. In US, there's specific guidelines for some of these nodules that need to be followed up with images. So stay safe. All the links are going to be in the description to the video. I'll make sure that we include the table that I just presented, as well as the link to the article. And if you like this content, please do subscribe, and we'll see you back here on this channel for more. All the best to you. Take care.